I'm so pleased to be invited by NaDiMa to talk about the COVID-19 and the challenges and the lessons learned that we can have from this pandemic in my beloved country, Iran. So what I'm going to do during the next few minutes of the presentation is sharing with you some things which happened, the experiences that we have had. And to start with, I would like to begin with one acknowledgement, which is now on 26th May 2022, Iran has reached a situation that COVID-19 has, unfortunately, still 5 cases of death. But you remember that we had several hundreds, almost 1,000 cases of this one just a few months back, and a number of casualties and consequences. So the fact that I'm going to discuss about the challenges and the shortcomings of the policymaking in Iran has nothing to do with the acknowledgement of the situation that we are standing at the moment, which is we have reached a very good position at the moment, and COVID-19 still is not over, but we have reached a number of good achievements. Like if you look at the bottom line, you can see that almost more than two-thirds of the Iranians, adult Iranians, have been fully vaccinated, which stands in part with the European and OECD countries. But from now on, let me talk about the challenges that we have faced. If you look at the high bar, you can see that the new cases of COVID-19 we have been facing, the red bar is Iran, and the blue one is the world. So you can see that in some occasions, many times, the number of casualties and the number of deaths has been much higher than the global average. If you look at the bottom graph, you can see that the average case fatality, which is the power to make people dying, is higher in Iran and has been higher in Iran on the red bar compared to the rest of the world. So this is one of the realities that we need to understand when we are discussing about the country. Why I am eligible to talk about this from the outset, from the first day of COVID-19 identification in Iran, because this was identified by the School of Public Health at Tehran University of Medical Sciences on the 19th of February 2020, and the School of Public Health, which I am proudly affiliated with, I established a group, and I have been working with a number of research groups from across the world to do the policy analysis, timely policy analysis, and somehow feed into the policy making of the country and globally. So that's why from the day one of the start of this pandemic in Iran, and even before the declaration of the pandemic by WHO, my team have been involved in policy analysis of COVID-19. That's why I'm bringing with you some kind of these experiences. Let us have a kind of very brief timeline of COVID-19 policy challenges in the country. So February 19, 2020, the first COVID-19 case identified in the city of Qom, 150 kilometers south of the country, by a School of Public Health. And then this is, after that, 2 days later, we had the parliamentary election. So very big mass gatherings and people stand to each other in the queues to give their votes. And then on March 2020, about 2 weeks' time, all 32 provinces were infected across the country. So then after that, on March 20th, we had the beginning of the Iranian New Year and officially the first wave. And then we had some kind of restrictions. Immediately after that, we had the opening of the schools, mosques, and others. And then again, we had the second wave, which started on the May 2nd, 2020. Again, the scenario happened, reopening, and again, on September 1st, 2020, beginning the third wave. This cycle continues, and you can see by July 2021, which was the beginning of the fifth wave, and the January 9, 2022, which was the beginning of the sixth wave. So my country has been experiencing lots of waves, 6 waves so far, and the last 8th wave somehow more horrible than the previous. So this is the situation we have been facing. But my point is this: despite the situation that we are standing now, and now we can say that we have somehow managed COVID-19 with casualties and things, despite all odds and challenges,
But during these 6 waves, we have been facing a number of categories of policy challenges. And these 9 categories, which I'm going to discuss very briefly. This has been discussed in a big paper, which will be published very soon, and which we call it the dilemma of policymaking in COVID-19 in Iran. But these 9 challenges are huge. Some of them are over, some of them are still ongoing. I just give you some examples just to share with you some kind of touching upon the surface of these challenges, starting with insufficient coordination or lack of intersectoral collaboration, contradictory measures, inadequate timely measures, or lack of use of scientific evidence, or unfulfilled promises and decrease in the public trust, or national multidimensional vaccination plan, or management, or delayed guidelines, or unfair sanctions. All of these things have provided us with huge challenges, which I briefly discussed with you today. The first challenge is insufficient coordination and inappropriate intersectoral collaboration. Some examples. All of you are aware that Iran has been very privileged to enjoy from a very comprehensive primary healthcare network across the country, specifically in rural places. But unfortunately, we didn't utilize our extensive primary healthcare network during this COVID crisis in a good capacity, or inadequate coordination between the primary and secondary care, or lack of communications to the public. I mean, public was somehow begging the officials to give them information, but unfortunately, infodemics was the dominant phase, or increasing the number of people visiting the hospitals because the primary care wasn't functioning that much well. And unfortunately, this is one of the main challenges. We did little meaningful communications among different scientific groups. If you look at the Ministry of Health, the majority of technical people were epidemiologists, whereas health economics, health policy, psychology, social sciences, media, public policy, information technology, they were missing. So the majority of scientists, even though we used scientists, but the majority of them were epidemiologists. If you look at the conceptual framework to enhance intersectoral collaboration in pandemics, I don't have time to go to the details of this. Some of this we manage. For instance, we established National Committee or National Coordination Committee for COVID-19, led by the President of the States. These are the positive things. Or we somehow engage with all these groups of people you can see here. We established some local, national, provincial, and regional collaboration. But unfortunately, the coordination among this wasn't that much helpful and meaningful. Just one example. For instance, at the beginning of the 4th wave, which was at the beginning of the Iranian New Year holiday in March 20th, 2020, the Ministry of Health and Medical Education, as the technical body of the National Coordination Committee, warned about inevitable concurrence of the 4th wave and the outbreak with the New Year holiday. Whereas the National Coronavirus Committee and the head of that, which is President, he said, we don't need to impose any serious restrictions during that. And the COVID-19 peak has ended, or no longer necessary to follow the related health protocols for social distancing and other things. So you can see the contradictory messages that we are receiving from the officials. And this was somehow the beginning of the problem. We published a piece in the BMJ, and those in the health system, you're aware that the health system, based on the World Health Organization, have 6 building blocks. Based on our experience in Iran, we suggest that we need to add 2 other building blocks at the bottom of this bar. One is meaningful intersectoral collaboration, and the second is appropriate and functioning surveillance and response system. So this is among the big challenges that we face in Iran. Based on our lessons learned, we encourage this to be the case. Okay, the second policy challenge. The second policy challenge was incoherent and contradictory measures and statements. Just one example. The president, as the head of NCC, he said, on the March 27, 2021, the COVID peaks have been ended. There is no longer need to follow up health protocols. The significant decrease in the number of travels during Nowruz has happened. Whereas in the same organization, the National Committee for COVID-19, the spokesman is saying on the April the 3rd is compared to the last year, we are witnessing 100% increase in the number of travels. And on April the 10th, 1 week after the New Year holiday, he said the public adherence to health protocol have reduced to 56%, not totally. So you can see that how different people, different officials are talking about these things. Worse still, we had frequent changes of front-line commanders, officials, policymakers, members of the NCC, and which somehow left the officials for contradictory policymaking. The third challenge, inadequate timely measures. In one word, if I want to say, you colleagues, friends, Iranian, we are delayed. I don't know why. We are delayed many times in making appropriate things. We make the decision finally, but sometimes very late. We had delays in almost everything in the beginning of the COVID pandemic, and even during the consequent phases and during the consequent waves. Delays in announcement of the disease spread, delays in the acknowledgement of the seriousness of the disease. I remember, some of you remember, on the national TV, on the media, we had some people on the TV showing that nothing has happened. This is business as usual, like the seasonal influenza. Or delays in restricting international travels, specifically flights from China. Delays in restricting mass gatherings, such as nationwide parliamentary elections. Delays in timely and equitable distribution of vaccines, and lack of paying attention to contact tracing and other things. And still, some of those are valid in this. We have created this kind of comparative policy learning from some countries. I don't know to which extent you can see that, and I don't have time to go to the detail of this graph, but my point is this. You can see some very successful countries like Singapore, South Korea, Taiwan, the East Asian countries who are very successful. And you can see some worst case scenarios like Italy, Spain, United States, and this kind of country who didn't manage quite well, and Iran as well, which is in this color. This is Iran. I don't think you can see this chronology, but what this graph, I'm more than happy to provide the slides for all participants. What this graph says is in countries like Singapore, you can see, even before the declaration of pandemic, Singapore started to impose the restrictions based on the lessons learned from the SARS pandemic back in 2003. South Korea was the case as well. But some countries like Iran, some countries like the United States, there were some delays. The point is, delays ended in some consequences. We had inadequate use of scientific evidence as well. This is a big story. Evidence was limited. Not all specialists who are supposed to be involved in this very complex task of managing this pandemic were invited. For instance, experts warned about the likelihood of the second wave, and they emphasized on social distancing, staying home, and banning the gatherings and things. Whereas the National Committee said, insisted on reporting and reopening the business as usual, or no specific measures were taken to close roads during the national. They held public and religious events. These are somehow contradictory things and inadequate use of evidence and not listening to the experts. And they didn't quarantine the city of Qom, which was the epicenter of COVID-19 back in February 2020. They labeled, there are some officials, I remember, they appeared on the TV and they labeled quarantine as an outdated and medieval intervention. And they held national and religious occasions. They persisted on opening the business on schools. If you remember in my third slides, you can see that anytime they had reopening, after that we had another wave. And another wave was much more severe compared to the previous wave. They persisted on opening the businesses and they didn't impose any traffic travel restrictions. And ironically, they imposed travel restrictions on private vehicles, not on the public vehicles. So you can imagine that people could sit in the bus 40 together and travel, but not in their own cars with their own families and members of the bubbles. This kind of lack of evidence use was somehow very devastating. And initial endeavors to pretend that situation is normal and delay in the use of electronic health record was the case as well. I need to be a little bit quicker. This is a very important graph. This shows on the right-hand side, you can see a stringency index. In Farsi, we call it Zarib Sakhgiri. which means that if you look at the red bar, the more we take the cases serious and restrictions serious, the less the mortality is. And here, the green one are the new cases, and this is the stringency plan. If you match these two graphs on each other, you can see whenever the stringency index is higher, the mortality is lower. So and this is global, from the beginning of the pandemic up to now. What this shows is we have enough evidence that social distancing, protocols, and stringency plans in order to control the pandemic really works. But unfortunately, we didn't use. We conducted an interrupted time series analysis of the new cases during the different waves of COVID-19 in Iran. This is being published very soon. And if you look at this, which is the fourth wave, at the beginning of the fourth wave, this is the travel restrictions. And then at the beginning of the fourth wave, the travel restrictions slowed. And this is the restrictions on the use of the personal vehicle. You can see that the use of the personal vehicle decreased as well. And on the basis of this, the consequence was the increasing the number of deaths. So you can clearly see this has been the case. The fifth policy challenge was unfulfilled promises and somehow saying something to the public, and which didn't happen. And this somehow decreased the public trust about many things. Delayed in supply of vaccines, insufficient transparency in vaccine distribution, delayed in administration of the vaccines, emotional and misleading statement by authorities, non-fulfillment of the promises, inaccurate announcement of the vaccination figures, and these kind of things were among those. Again, if you look at the timeline of COVID-19 vaccination, the point is we started our vaccination and think about importing the vaccination right after the COVAX mechanism. And we enrolled and we paid for COVAX. And at the same time, we started the domestic production of vaccines in 7 different platforms. I don't think any country in the world has invested on 7 different platforms for domestic vaccine production. And you can see that some vaccines were delayed. The first bunches of vaccine arrived in Iran on February 4th, 2021. And then the rollout started in January 2021. And then until September 6th, 2021, there was no mass administration of vaccine for the citizens. So you can see there is a kind of huge delay in mass vaccination for the citizens. And this goes back to many things. That this is despite the fact that the government has promised that we vaccinate 60 million Iranians, 95% of the adult population, and we administer 400,000 doses a day. This didn't happen. This didn't happen until 6th of September. This is very important as well. This is the daily share of the population receiving the vaccine. You can see that until, and this the red bar is Iran, and the dark bar is the world. You can see that until September 2021, Iran is well behind the average world. This is September 2021, which is a kind of sharp increase in vaccination. And then we somehow surpass almost all countries. And then after that, in December 2021, about in the last 5 or 6 months, we are in par or even higher than the rest of the world. So now, if you look at the number of vaccinations, we are pretty much good compared to the Iran, compared to the European and high-income countries. But this delay, the beginning delay, was one of the main causes of the difficulties. And this is the proportion of vaccinated people. So you can see the proportion of people received at least 1 dose. That's the case. And again, you can see from September 2021, there's a sharp increase. This is the second dose, and this is the booster dose. So in terms of booster dose, it's almost 1/3 of the population. So still we are lacking. But in terms of the second full vaccination, full vaccination, we are not that much bad. So we have somehow reached. But the thing is, until September, we have been lagging behind many countries. And this is the point and the miracle of vaccine. The red bar is the casualties, the confirmed new death cases per million, and the yellow one is the proportion of people who fully vaccinated. You see, the more vaccination, the less cases of death. And so my point is, when I say the policy challenge that we faced, this policy challenge was when the vaccination was delayed, we faced some kind of casualties, higher casualties, and not necessarily the government is going to be accused of this. There are other things to that. And still, if you look at the global picture, you can see this is our beloved country, Iran, here. And we are among the countries with more than 20 million population unvaccinated, including the children, of course. But you can see, we can compare us, for instance, with other countries in North America and even in Europe. So now at this, and this is from 15th of May, so we are not that much bad. One of the main reasons for delayed supply and distribution of vaccines was sanctions, responsibility of foreign currencies for COVID. Sorry. Because, for instance, we purchased almost 17 million doses of vaccines from COVAX, but the delivery and procurement was delayed, insufficient budget allocation, and somehow conflict of interest in the domestic production. So too much domestic investment. And at the moment, we are facing some kind of problems for the export of those. We had those challenges in, excuse me, we have those challenges in medicines as well. Challenges, lack of transparency, accountability in the drug supply chain, and stewardship of a pharmaceutical system, and information on drug shortages. For instance, if you look at this table at the bottom, you can see that for some medicines like remdesivir, the black market is much higher than the public facilities. So some people had to go to the black market to buy some of these medicines, which somehow ended in catastrophic expenditure for health. The seventh challenge was management of resources and equipment. We had shortages in the management of strategic supply chain, inadequate human resources. Unfortunately, Iran has been facing huge sanctions. The payment hasn't been promising for the service providers, the burnout of the health service provider, the pressure of sanctions, the political economic factors which challenge Iran's ability to provide needed supply and access to medicine, despite the propaganda which says that access to medicine is not restricted. Delayed supply and questionable distribution of, even we had vaccines, the distribution wasn't very good until 9 months ago, 8 months ago. And just one quote from the head of Tehran COVID the provincial committee, he said, with the money we spent on the remdesivir production, 240 million doses of AstraZeneca vaccine could be purchased. So you can always discuss about this. And if you look at the challenges of management and during the crisis, you can see, and this comes from another paper based on other countries' experiences, but you can see that Iran faced almost all of these shortages of emergency, critical care, rapid changes in the number of patients, lack of access to the capacity, the PPEs, and other things which Iran faced as well. The eighth challenge, I'm almost finishing my presentation. The eighth challenge was delayed, updated, and agreed guidelines for contract tracing and patient flow. For instance, during the first wave and partially during the other waves, one of the main challenges which I would like to re-emphasize is we didn't utilize our extensive, fantastic, state-of-the-art primary healthcare system. We built many different mechanisms, many different plans, and we did our utmost effort in order to address the challenge and outreach the citizens. But unfortunately, we didn't use the very extensive facilities, which is almost everywhere across the country in urban and rural setting, in order to train the public. So lack of appropriate protocols for screening, contact tracing, referral, temporary health centers, rehabilitation patients, and this kind of things led to patients and healthcare system confusion, burnout, and waste of resources, and insufficient resilient health system, which was somehow the end of it. And finally, unilateral political sanctions against Iran. At the outset of pandemic, we wrote a piece in the Lancet, and we plead, and actually I led a petition. 5,000 Iranian physicians signed the petition to the Secretary General of the United Nations, and we asked that these sanctions is affecting us very badly. And then this kind of sanctions restricted access to some medicines, to some procurements, to some supplies, to some vaccines and PPEs and many other things. So this challenge was somehow inevitable at that stage. Let me conclude by saying this. This graph, I'm sure many of you have seen this. This is a very comprehensive graph coming from the European Union. So WHO Europe has produced it as a part of Horizon project. It's very interesting and informative. I don't have time to go to all of part of that, but one message here, which is my main message, is crisis, specifically pandemic, is a kind of a springboard. And we need many things to manage pandemic. Since future pandemics are very likely to happen, we need multilateral action. We need social solidarity. We need a strengthened focus on global challenges. We need global interaction. We need partnership. We need to bring all stakeholders together, politicians, citizens, diplomats, scientists, everyone, healthcare providers. So based on that, the policy recommendation is we need to have a good leadership based on evidence. We need to ensure open channels of diplomacy. We need to engage with different stakeholders. We need to promote science. We need to create platform in order to bring all citizens together, and we need to diversify our resources. My last point is, if we want to share our lessons for performing better for future pandemics, of course, we need to hope for the best and prepare for the worst. That's always the case. If you look at the United States, I remember one of our papers which are introduced and which has been cited very much, comparing Iran policymaking with other countries. We have identified the United States just 6 months before the pandemic was identified the most resilient health system on this planet. Whereas when the pandemic happened, United States went down the list as one of the least good functioning in terms of managing that. Why that's the case? The case is because they were not resilient enough in order to do that. So the lesson learned is we need to have efficient intersectoral collaboration. I made you some examples. We didn't have it, despite the fact that we did a lot, but we didn't have efficient, and still we don't have our efficient intersectoral collaboration and community participation. We need to build upon social capital. We need to have functioning mechanisms during the peacetime and before the pandemic in order to have citizens together. Citizens togetherness adds to the social capital and adds to their functions during the rainy days. We need to have active surveillance, response, monitoring, and evaluation system. Our CDC wasn't that much strong, to be honest, and I need to confess. We need to somehow improve our CDC, and we need to have a functioning electronic to identify high-risk groups and places. Electronic health record is a kind of sad story in this country, and it's very, very difficult to understand that. We need to have integrated information system at all levels, which needs to be connected to the industry, which needs to be connected to the private sector. One thing which is one of the main lessons is whole of government, whole of society approach, which means that we need to employ the principle of good governance, like transparency, public participation in decision-making, accountability, responsiveness, use of evidence. If you look at the experience of Iran, which I briefly explained, we have been suffering from the lack of this in all stages. And strengthening the health system building blocks, which I mentioned. Health in all policies is very important. Enhancing equity, colleagues, friends. COVID-19 showed the world that the people who suffer most are the most vulnerable and the poorest parts of the society. We need to have functioning mechanism to reach out them, reaching out the poor, reaching out the vulnerable, the people who are at the lowest quintile of the society, people who have no other choice to go out. to make money for the families, to win the bread for the families. There is no other magic formula for that. So we need to have mechanisms in place to reach out them. Good governance for health is very important. A strengthening resilience through a strengthening health system building block. Family physician and referral system is very important. We need to have good referral system and transparent and coherent public communication in order to minimize infodemic. Infodemic was very, very devastating in Iran. Infodemic means everyone can have access to social media and can spread misinformation and mislead people. My last point, look at these 3 circles, very integrated circles. I finish by this that say, our lesson to the world is, for future pandemics, which are very, very likely to happen, we need to have universal health coverage, meaning that we need to have a strong health system affiliated and in collaboration with other aspects of the public policy. We need to have universal health preparedness, which means that the entire world needs to be prepared, and we need to have universal health solidarity, which means we need to have some mechanisms in order to reach out all parts of the society, specifically the poor. Let me finish with this quote from Winston Churchill. When the World War II ended, Winston Churchill said, "Success is not final, failure is not fatal, it's the courage to continue that counts." I would like to thank you very much for your attention, and I would like to thank my colleague, Ms. Azam Raoufi, who helped me to put this presentation together. Thank you very much, Dr. Alaedini.
Thank you very, very much for this excellent and highly informative presentation. I have a number of questions, but since we are running late, I will not pose my question, and I also ask the audience to keep the questions until the end and then pose it then, or you can also type your questions, but do that towards the end because we may miss your question. So I'm going to ask our second speaker to please upload your presentation. And the title of the second presentation, Person and Place-Based Policies to Strengthen Community Resilience During the Pandemic, by Dr. Kosar Karimipour, who is a senior researcher at Center for Building State and Society Capability. Dr. Karimipour received her PhD in sociology from McMaster University in Canada and moved back to Iran in 2018. She did a postdoctoral fellowship at the Shahid Beheshti University and then joined the Center for Building Society and State Capability as a senior researcher. So I asked Dr. Karimipour to kindly start her presentation. Dr. Karimipour, yeah, can you, Dr. Takian, can you please remove your presentation? Thank you.
I am now sharing my screen.
Yes, thank you.
But it's going to take a while, probably.
Yes. So since I should mention something, I should announce something, that we have 2 survey questions just before the end of the event. And I ask you to kindly respond to those survey questions toward the end of the presentation.
Sir, do you have my screen?
We do have your screen, yes. And if you use your full screen presentation
Sure.
Screen, it will be better, because right now we see it, it's very small. Yes, it's good now. It looks good.
Okay. Sorry, just a minute. I just want to time myself to make sure that I don't. Okay. Hello, everyone. Thanks for inviting me. I was an academic up until a few years ago, and then I've now been active in the policy world in the last 2 or 3 years, and I think it's important to bridge this academia policy work gap. So I'm going to talk about person and place-based social protection policy to strengthen community resilience during the pandemic. I'm going to start with like a very short introduction to the structure of social protection in Iran. So the social protection system in Iran, if we want to take a look at it based on the annual budget allocations. So if you see, if you take a look at the annual budget allocation and categorize the allocation, you'll see that the social protection system in Iran is offered in many different areas, such as healthcare, employment, insurance, cash and in-kind transfer, social insurance services, housing, and so on. And as you can see, these are different, like this is a color-coded graph. So as you can see, I know this is like too small and you can't read the text, but you can get an idea of the multi-sectoral, complex, multi-agents social protection system in Iran. But there are many different programs, many different organizations involved, very different target groups. So if we, for example, just focus on the education, the blue thing, you can see that like if you are a student with learning disability, there are many different distinct programs that is offered to you. If you are covered by the state welfare organization, then the educational, there are certain educational services that you can receive. If you are a student or out of school youth, if you are an individual with exceptional talent, if you are a university student, there are different organizations that you can go to, or different organizations will contact you to offer you their services. So just by this, what I'm trying to say is the social protection system in Iran is very complex, as this is the case in many countries, though. But adding to this complexity was the pandemic. The pandemic started, and the social protection system in Iran wanted to offer extra services to protect the vulnerable, especially the vulnerable groups and people. So what here I'm just because I work for the Ministry of Cooperative Labor and Social Welfare, I'm just offering the programs offered by Ministry MCLSW, Ministry of Cooperative Labor and Social Welfare, and the Deputy of Social Welfare of this ministry. So the deputy offered low-interest loan of 1 million TUMS to low-income households during the pandemic. The Deputy of Social Welfare implemented an unconditional cash transfer program between 200 to 600,000 TUMS monthly to low-income households during the pandemic. In collaboration with UNICEF, the deputy rolled out a Cash Plus project for the pandemic-related school dropout, but just in selected cities. So it was like a pilot program, and the distribution of hygiene kits to curb the spread of coronavirus through 12 different charities in collaboration with UNICEF. This is just a very quick overview of what MCLSW did and to extend its social protection programs during the pandemic. But how was this possible? Like you saw how complicated the system is, and what made this services, what made the offering of these services possible was the Iranian welfare database. What is the Iranian welfare database? The Iranian welfare database consists of 60 collective data sources in 500 information fields. So it's it offers services. How like it was since its inception in like it's been 5 or 6 years since we've had this data set, and in order to encourage different organizations, more than 50 organizations, to collaborate and share their data. The Iranian Welfare Database has way to motivate data provided to motivate these organizations to cooperate. For example, they're in a mutual understanding. Organizations provide MCLSW, the ministry, with their data, and in return, they benefit from other services that the MCLSW provides. For example, the welfare organization provides, like, share their data with the ministry, and the ministry gives the the related fields of data from its database to share the related fields of data from its database to with the welfare organization to motivate them to keep sharing their data. There are two methods of updating process: replication and file. And this is like some of the weaknesses of the Iranian welfare database, because only 2 data sources use the replication method, and the rest, they just use the file method. And in sharing their data and updating their data, they don't in using the file method, they don't adhere to the time periods and a stable structure in presenting data. And despite many follow-ups, the data is not usually up to date. And for quality control, the organization's unreliable data varies between less than 1% for organizations such as the Central Bank of Iran and the Imam Khomeini Relief Organization, to more than 40% for organizations such as Post Office and the Omid Entrepreneurship Fund. So we use this, but nonetheless, despite its shortcomings and weaknesses, the Iranian welfare database is a very helpful tool in providing social protection services and in implementing social protection policies. For example, using this database, we could find the low-income family. We could target the low-income family and do the and implement the unconditional cash transfer program to protect them during the pandemic. So we had used this before for the subsidy report, for the elimination of individuals in the highest income decile, for the eligibility testing of the beneficiaries of some of our social assistance programs, such as livelihood support, the eligibility testing for Salamat health insurance, the eligibility testing of the individual current, as I said, covered by social assistance organization. We use this to monitor employment of university graduates, not as a policy tool, but for research purposes. We use this to create management dashboards for different managerial positions in the government, and we use this to create household socioeconomic profile to use when we need to decide and target certain households for specific social protection services. So what is lacking here is we know right now, using this household socioeconomic profiles, we could, for example, find a low-income household in the country and offer them, for example, low-interest loans or cash transfers during the pandemic, which we did. But what is lacking here is that we cannot offer a universal, like it's not effective and efficient to offer a universal national level protection to all low-income households. So what we're trying to do in the government right now is combine person and place-based data to coordinate social protection initiatives. So again, as you saw, we have a very complicated social protection system, different organizations, different agents, different target groups. And for coordination, in addition to using person-based data, which is the Iranian welfare database, which is the household level socioeconomic status, we're adding place-based data to this. We're trying to add place-based data to this database. So place-based data focuses on disadvantaged areas with unfavorable climate conditions, inadequate infrastructures, or lower social or economic development than the national average. So this means we would like to increase investment in targeted area and grant concessions to local government in these specific area. The person-based database, which we currently have, can be used to identify vulnerable households on a national level by combining self-reports and registration welfare data. So this database can be used for programs such as for cash transfers program during a crisis like a pandemic, or in general, conditional or unconditional, low interest loans, social insurance, or other type of social protection tools. A place-based policy usually have lower targeting costs, and it strengthens local identity and a sense of belonging to a specific place or location. But the deficiency or the weakness of a place-based policy is usually when you invest, it usually happens that when you invest on the development of a specific place or region, it will lead to rising costs of renting houses, goods, and services because of these new investments. And it's been argued that usually at the end, maybe as an unintended consequence of this regional policies or place-based policies, that rich people benefit more or sometimes only because there is, especially because usually place-based policies don't have an appropriate redistribution policy and executive capacity. But person-based policies have better targeting, and but they're inefficient in identifying weaknesses of local and national economy. So you can, it's easy to target low-income households during the pandemic and just give them 200,000 to 600,000 2 months. But it's not easy to, but it's not possible using just a person-based policy to understand the weaknesses, the local conditions, and to understand, to decide based on the local conditions that which group needs what. So focusing on just person-based policies encourages people to migrate to better opportunities, the margins of the big cities, and we have expansion of marginalization and reduction of social capital as a result of these kind of migrations. So what here at the ministry, we're trying to establish the discourse of combining place and person place-based policy approaches to protect individual and households while paying attention to the factors that reproduce poverty and vulnerability. So combining the quantitative and qualitative aspects to poverty at the same time. So in combining person and place-based approaches, we consider the place-based factors that affect the possible effectiveness of the policies, and we recognize vulnerability here by combining these person and place-based approaches. We recognize vulnerability as a structure of failing. So during the pandemic, small and medium-sized businesses, for example, in a small city in Iran, may face different difficulties compared to small and medium-sized businesses in big cities, or in rural areas compared to urban areas, or a female-headed household, a vulnerable female, low-income female-headed household may need in a certain area, in a certain city, might need needs different types of protection, different policies than a low-income female-headed household in Tehran. So here, just the place-based database hasn't been established yet. It is in the process of establishment, but we, using the data that we had available, we created a mini place-based database. We combined that with the person-based database that we have, the IWD, the Iranian Welfare Database. And combining many different place-based and person-based indicators, we divided different counties in Iran based on their level of person and place-based vulnerability. So if you look at this, dark blue, and I don't like the colors here, but I didn't have time to change the colors for the map. So dark blue is individual-based poverty, very high individual-based poverty and place-based deprivation. The counties that are colored purple have a high individual-based poverty and place-based deprivation. The gray ones have medium individual-based poverty and place-based deprivation. And when we're talking about place-based deprivation, we're mostly talking about like cultural, social, and economic level of development, so infrastructure, and we are also talking about climate and access to water resources and so on. So it's a very multi-factor concept. The green ones have low individual-based poverty and place-based deprivation. So if you look at, for example, this is the province of Kerman, and usually in Iran we have the unit of analysis for policymakers is province. And one thing that this suggestion that this this approach suggests is that the province as a unit of analysis for decision making, is not an effective and efficient unit, because as you can see here in the province of Kerman, for example, this province or province of Khuzestan here, this province, you can see that there are counties of different colors, all 4 different colors in this province. And this is the case for many of other provinces. So here we have in Kerman, we have many green counties, which are very low in terms of their individual-based poverties and place-based deprivation. And we also have purple and dark blue, which are very high in their place-based poverty and person-based poverty and place-based deprivation. So this means, this again shows the importance of combining person and place-based policies to categorize the counties, and this is how, by combining these person and place-based policies, this is how we can take the qualitative aspects of poverty and like factors that reproduce poverty into account. So we can, for example, say that in this county we have food security problem, in the other county we have maternal and child health problem, in the next county we have the priority should goes to avoiding unwanted pregnancies and childbirth, and in this county the priority for example the people for the unemployed is skill training and job search. So this combining person and place-based policies can help you to understand the structural sources of vulnerability and poverty, can help you make a local decision, can help you strengthen your local community, and can help you prepare and can help the communities prepare and become more resilient for the next possible crisis. I can see that my time is up, and so I'm just gonna stop here, and thanks for your attention, and look forward to your comments and suggestions. Thank you.
Thank you very much, Dr. Karimi. This database is very interesting, and originally when the ministry started it, I was kind of skeptical, but with the discussion that you just provided, I'm less skeptical, but I have a lot of questions. Again, I will not ask them, and because we are running late, and I also asked the next speaker to speak for the, I'm not sure if we told our speakers to speak for half an hour or 20 minutes. It's supposed to be 20 minutes. So if you can keep it to 20 minutes, I would definitely appreciate that. Our third speaker, before our discussant, we have a discussant as well, is Dr. Hossein Mirzapour. His title for his presentation is Morality or Productivity, ? Digital Tracing Apps During Pandemics. Dr. Mirzapour is founder and chief executive officer, as well as the director of Data for Governance Lab. He's a member of the high-level expert group to the Sharif Policy Research Institute on business to government data sharing. Again, I'm summarizing his achievements, and I apologize for that. He was chief ICT policy advisor to the Ministry of Telecommunications and Information Technology. At the lab, he has been developing various research projects especially on big data and other emerging and disruptive technologies for decision and policy making. Before joining the lab full-time, he was a senior research fellow and sessional lecturer at the Department of Administration and Decision Sciences in Montreal, Montreal. He's also taught at various schools in the past. So with that introduction, I ask Dr. Mirzapour to kindly start his presentation, and please keep the time within the appropriate limit that we have. Is this?
Go ahead, Dr. Alaedini.
Yes, please go ahead. Please go ahead, Dr. Mirzapour.
Okay.
It's all yours.
Thank you. Thank you for letting me sharing my ideas today during this nice event. And hi, everybody. As we are behind the time, I try to be as quick as possible, so I would leave more time for Q&A. would you see my presentation right now, my slide?
Yes, looks good.
Very good. So today I'm going to talk about a specific issue which is talked a lot after pandemics, whether those digital tools are violating our morality or privacy or not, and is this a real issue and a barrier to apply them for future pandemics in the future. Uh, Back to the beginning of pandemics, if you remember all those strict lockdown, there was always, almost I can say, in all countries, a challenge, a paradox, whether we'll have more lockdowns, we reduce economic activities, or we let them people do their transactions, and we release them of those lockdowns in the sake of more economic activities. That was a real challenge. Wealth or health, in some countries we see that they were really strict in terms of lockdowns. For them, the mortality rate was everything. In other countries, maybe no, not so much, and because of many reasons. One of them is like the level of poverty or etc. They were not so much strict in lockdowns. So one of the solution to this challenge and paradox was applying the smart approaches like the digital tools. In many countries, we have seen this application of smart approaches to pandemic. Uh, there are several functions for those tools. Let me call them data-driven digital tools. One of them is contact tracing. Another is symptom monitoring, quarantine control. You should know them very well, at least in the news. Whether you have already installed them on your devices or not, you should have heard of them. In all of them, let me say, in all of them, you share somehow some access, private access with them. For example, in digital contact tracing, which is a broader phrase, broader title for them, they can see your friends, your families, your relatives, name, contacts, many kind of private informations. And in a more specific type of those applications, which is called proximity tracking applications or PTAs, we will face mainly two kind of technologies. One group, they are working with Bluetooth. If you have a smartphone, you should have seen those Bluetooth sign there. So when two people with both Bluetooth on, they are close to each other, this kind of application will realize that they had already contact, and so if one of them is in risk, they can inform the other one, they can notify the other that you are at risk because of this like contact. Or the second kind of technology they use is GPS. Based on the GPS, it's like in terms of the contact tracing, GPS is less exact, because if you know that the exactitude of the GPS is less than the Bluetooth in these kind of technologies. So the question is that why, if we see that all those applications, most of them, they were not so much successful. Although in some countries, as Dr. Takian, I think, mentioned, like in Southeast Asia, we have seen that the prevalent use of those applications, but overall speaking, we don't see so much, we can't claim a global success for this kind of data-driven digital technologies. So the question is, we have a lot of questions. We have seen them in the literature. One of them is the actual technical efficacy of the PTAs, like this kind of proximity tracking applications based on Bluetooth or GPS. Of course, it could be an issue. Is the efficacy, the actual technical efficacy, and the productivity was the real reason that they were not successful? This is a good question, but it's not our question for today. The second question is the minimum social acceptance or network effect. If in a society of like Iran, more than 80 million people, the whole population, if there is not the minimum people who have already installed this application on their smartphone with the access to their Bluetooth and GPS, and both of them are on, so if there is not a minimum of this kind of people, then it is nothing, and there is really a big chances that there is a big chance that you face the risky person, and this app will realize and it will tell you. So this is another big challenge against the productivity of like this kind of tools, digital tools. But again, it's not our main question, or we are looking for a specific reason for this, like lack of minimum social acceptance, which is the privacy issues. You know that digital surveillance and like all those digital world, which is supposed to violate our privacy in somehow, it's a big issue since a decade, more than a decade. But especially today, I'm going to talk a bit more, especially after the pandemic, which people were in a dilemma whether they use these apps, but they let their private information is published through a specific channel with the database of these apps, and of course, if governments they let those kind of apps are prevalent in their sovereignty or not, and it has several aspects. This privacy, whether it violates your personal value, whether it has some security issues individually or nationally, because it gathers a bunch of data from all your people, and it's a big database, really important database. And of course, it could have some ethical issues. For example, if you have seen on the news that, like in UK, for example, they realized with the same technology that one of the minister had, one of the, I don't know, ministers or VPs was in relation with somebody else. Just, there are many reasons that people may find this kind of digital tool, data-driven applications violating their privacy. What we are looking for, or we have done this, this is research still open. We have focused on an Iranian digital tracing apps, which is called Mask app. So to look for any evidence which privacy or morality was really an issue or not. And of course, we have done a literature review. In sake of time, I don't go through the details of those literatures. In the literature, you will see a lot of discussion about all those questions. This one, let me just stop a little bit on this one, which is done on exactly 2 years ago. They have done a research in I think the second half of the month of May 2020, the year 2020, exactly 2 years ago, and they have monitored 17 apps in 15 countries. And a bit surprisingly, almost, or not, let me say, the majority of all those apps, they didn't clearly mention their storage policy, whether they keep the data of the people in a specific database in the country, it is end-to-end encrypted or not. There was no clear storage policy about the data of all those people, of all those users, and it was surprising. But again, you can see the information in the future. I can share this slide, and you will see the method of data collection for each app, the type of data, the country, the name of the app, and whether they were protected by data protection law or not, etc. So, what was our research method? It was semi-structured interviews, document analysis, and attendance at relevance webinars, where we had many interviews with mask apps developers in Iran, the team members, and the founder, managers of the health ministry of Iran as well, critics and experts. And it was a snowball sampling. This is just a snapshot of the mask app. I hope at least the Iranian participants today, they remember this app. It was somehow advertised by many media in Iran, and they tried really to advertise it through people. It was created by a team of professors and graduates and students from Sharif University of Technology, one of the Iran's leading engineering institution, and it was on a purely volunteer basis. At the beginning, I think it was working with via Bluetooth and then GPS. So this mask was well created and using both those technologies. But later, they provided with a map of high-risk urban areas and cities regarding the COVID penetration, and they added another option to monitor daily health conditions of users and their family members' risk of contracting the disease as well. So, what was the result then? Unsuccessful in proximity tracking. So, I think the number of people who already installed this app was far behind the minimum acceptance necessary to have a real successful digital tracing apps. Hardly they reached the 1 million active users, I think. So they tried to include debit card payment terminals, but this kind of data comes from access to the Central Bank of Iran, so it's governmental data, and it's not surprising that they fail as well to have that kind of data. Then, based on some data coming from the health ministry, a map of high-risk urban areas in Tehran based on government. They provided this kind of map. You see the pictures. So the information, the information taken from the user, the device was not so useful, but the information taken from the national system was useful for them, just to show people which region is risky and which is safe. Later, they provided the map all over 1,000 cities of Iran, and finally they transformed to a national COVID-19 data dashboard. If you remember, in some of the period of the time, I think for months, at least 10 months or even more, mask group was responsible to provide which region of Iran is red, orange, or yellow, and it was very important regarding the travel restrictions, if you remember. So they were somehow reference to imply some of the lockdowns and restriction policies. But today, it's not so much interesting that I say you that they are almost everything is off now, unless they have a social media channel to just share some news with people. So what we learned from this case and mask application from Iran is, first of all, we don't see no major evidence that morality was the significant barrier against the productivity of this app. This is the first thing I can say from this case. The second one is the result that digital surveillance infrastructure they provided is still partially active but in hands of Iranian government. After a while, I think quite recently, probably since the beginning of the Iranian New Year, the health ministry has stopped to share the data with them, so they are not anymore a reference dashboard to share the data with Iranians, and the ministry is directly sharing the information. But the technology, the idea that people share their private information to receive some information about the risk of their health is still there, and it is again an evidence we can see in other countries as well. So totally, I can say with like many other scholars that after pandemic we see that the states all over the world, they are more powerful in terms of keeping control of the privacy of their citizens. And the third one is government. Based on our observations, governments should pursue digital transformation through tools and apps that society is already familiar with. One of the reasons maybe Iranians, they didn't install so much and they didn't apply this tool was that they were not so much familiar with this kind of applications, putting their Bluetooth always on or GPS always on, which is a bit, using the phone's battery and charging, and they need to charge their battery sooner. So we see a path dependency in this regard, and it's very important as well. And the last but not least, before debating the privacy protection against the utility of these apps, policymakers should examine non-ethical issues. It is not always an ethical or privacy issue that people, they don't use such apps because sometimes they don't know it, they don't like it, the culture is not necessarily supporting this kind of tools, and it could be an issue even more important than the privacy issue. And we hope with this research, if we can finish it, we can let policymakers know more about how this kind of data-driven tools work, and we can prepare more for future pandemics. Thank you very much. And I put some kind of references for people who are interested in.
Thank you. Thank you very much for your excellent and very informative presentation. We are very happy to have also a discussant for this session, Mr. Peyman Zinati. He received his undergraduate and master's degrees from the Faculty of Social Sciences at the University of Tehran. Then he did a second master's degree at the London School of Economics. And now he's a doctoral student at the University of Exeter. And I haven't seen him for a few years, but he looks good. And let's see what he has to say about all these presentations. Thank you.
Hello, everyone, and thank you for this opportunity. And I'm happy to be here. So I will keep it short. I know that the time is tight. My understanding was that there are some connections between these presentations, and that one of the most important ones is data. Data for governance in Iran has been recently a very fashionable word, and I see also a very needed one. And I'm very intrigued with the policies and policies that are informed by these platforms that's been discussed here. But I have some repercussions and, to be honest, worries to share with you. And I had Mr. or Dr. Mirzapour, I guess, Dr. Mirzapour saying it was familiarity with the technology that was a problem among the population not using this technology. I also heard as well that public trust is coming across so many times. So we know that, for instance, Dr. Takian is inviting citizens' participation in policies. And so one of the questions that I have, and any of you can answer, is: do you see public trust as a big issue in policy implementation in Iran, and what's the source of that public trust? Because I felt that this optimism toward government is apparent in your presentation. As far as I have talked to people, those around me, of course, they are not a correct sample probably, but they wouldn't use such databases or would not contribute to them anyways because of the distrust in functionality of government in Iran. And I don't know if other participants here feel the same way. Also, there was an invitation to stringency policies by Dr. Takian. I have another question, which is, since Mrs. Karimpour here mentioned, Dr. Karimpour, sorry, social protection schemes in Iran are really complex and, as far as I know, are inadequate in their implementation and support. How would you recommend stringency policies in Iran when knowing that the income compensation policies are very inadequate? And that's it. Thank you very much.
Well, thank you very much, Mr. Zinati, for interesting question. I would like to, also, what I think I should do is to read, I've read a few, all the questions here that our audience has written onto the chat box, and then go to our speakers one by one and ask them to respond to any of those. So other than the questions that Mr. Zinati just asked, one question is about the quality of data in the welfare system. And I add a little bit to it. We've been waiting for a very long time to build this database. Wasn't it much better, easier to build the place-based program, a bottom-up program? We would have been successful and delivered our welfare policies or welfare services a lot better many years ago. But we continue to wait for this centralized database without even building that bottom-up approach. Another one issue that has been asked is was the mask, well, that's specifically for Dr. Mirzapour, would he consider the mask experience actually successful? And my own question was to Dr. Takian, why didn't they use the PHCs effectively during the pandemic? Was it political or there was some other reason? So I go one by one to first Dr. Takian, the same order. Dr. Takian, if you could go ahead.
Okay, thank you very much. And I would like to begin with thanking other speakers, Dr. Karimpour and Dr. Mirzapour. It was very informative for me and I really enjoyed that. And I should confess that I want to get rid of my last slide here and I don't know what to do. So this is not I don't have access to my slides anymore. So if you want to get rid of this slide, which is for the sake of equity, perhaps the administrator can do that. I cannot do anything about it. And okay, thank you very much. And thanks for the insightful questions. Let me begin with the issue of trust, which was mentioned by Mr. Zinati. That's a very important one. There are some mechanisms in the health system of Iran in order to engage with the citizens. Back in 2015, we do have a very pioneer mechanism for intersectoral or for fostering intersectoral collaboration within the Iranian health system. That's called Supreme Council for Health and Food Security, led by the president, and its secretariat is within the Ministry of Health and Medical Education. And the reason for that is fostering intersectoral collaboration. For instance, we know that fat is bad for your body, but the Ministry of Health
cannot do anything with reducing the import of, say, harmful fat into the country. That's the Ministry of Trade and Industry, or the Ministry of Finance, which somehow runs the customs in order to do that. So that's why the Ministry of Health cooks these things, then takes it to the Supreme Council for Health, and then they make the decision, and then this is a kind of upstream policy. This Supreme Council back in 2015 approved the bill for having National Health Assembly and Provincial Health Assembly. In Farsi, we call it Majame' Milli wa Ostani Salamat. For 2 or 3 years, we were bringing the public for health decision making. It was fabulous. More than 400 meetings across the country happened in very small cities as well. And then we had 2 rounds of National Health Assembly in order to bring the public into the decision making. Those are very powerful mechanisms in order to foster intersectoral collaboration, and more importantly, one of the pillars of the 5 pillars of good governance for health. And unfortunately, back in 2017, when the Minister of Health changed, this was demolished and nothing had happened afterwards, because they said, and we had the Deputy for Social Affairs within the Ministry of Health and Medical Education. So those are responsible for public engagement. Public engagement brings with it the public trust and increasing the social capital, which was very, very important and crucial for the COVID-19 pandemic and the way that we tackled with this very devastating crisis within our country and any society. We couldn't use that, first of all, because the health system was puzzled what to do with the public, how to reach the public. Dr. Mirzapour put in a very interesting explanation of mask was a very innovative way of tracing people and giving information to the people. But what happened to mask, Dr. Mirzapour? What happened to the use of the public with the mask? This is another story. So you on the side of technology can bring a state-of-the-art technology for the better use of people and for the better public good. But unfortunately, when the public is not following you and the public is not aware of that, or public is not part of that, then you cannot make the best use of it for the sake of public good. So that's the vicious cycle now we are struggling with in my country. Public trust depends on many factors: good policy making, good relationship between the policymakers and the public, good economic situation, and many other factors, which unfortunately wasn't the case. And unfortunately, because we had demolished a very functioning mechanism for engaging with the public, which was the National Health Assembly and Provincial Health Assemblies, and the forums which brings public together, we couldn't use that. That's my very short response to that aspect that you mentioned. And going back to your question, Dr. Alaedini, the final question, because I want to stop after that, and then if it was any time, I go back to other questions as well. You raised the question of the issue of public trust, and then the public trust into the government and into the policy making. This goes at least 3 pillars. One is in evidence-informed policy making. When you use evidence, even though the evidence could be contested, but evidence, because there are many pieces of evidence, then public can be led to the way of establish mechanisms for public policy making. So, and allowing the way of policy making, and during ages of policy making, they'll build up this trust. The second important thing is a strong civil society. A strong civil society is crucial in order to help the government in the 21st century policy making. You can never make a good policy without meaningful involvement of the civil society. In Iran, civil society is shaking and have a kind of sinus rhythm in civil society. And last part is the public itself. In Thailand, they believe that they have a triangle which moves mountains. This triangle have 3 pillars: public, government, academy. So academy brings evidence. The government is at the service of people, and people who who help the government in order to make good evidence. And the glue of this tree is the civil society. Why the government, going back to your last question, why primary healthcare network? If you ask me, after the revolution, in the last 4 to 5 decades, what's the masterpiece of the health system in Iran? I would say primary healthcare. Primary healthcare is the masterpiece of the Iranian health system. Why the government didn't use that? The first thing is, unfortunately, the majority of public policymakers in the Ministry of Health and Medical Education are treatment-oriented, because treatment is the place that looks luxury. You make hospitals rather than the health centers. You use the state-of-the-art facilities, very expensive drugs, ICUs, and other things. Unfortunately, in the course of last 2 decades, primary healthcare has been weakening. That's why the Iranian health indices has been somehow not worsening, but other countries are going ahead of us in the region in terms of health indices. It is not the COVID story. It started 2 decades ago. When COVID happened, we didn't have good advocates within the administration in order to do the PhD. The second issue is COVID-19 was very tech savvy. It needed lots of hospitalization and things, and because we didn't have a good functioning family physician program and referral system within the PhD, unfortunately it started 17 years ago, the family physician program, but because it didn't continue very strongly and it wasn't established nationwide across the country, then we couldn't use the PhD. That's why, despite efforts, advocacy, unfortunately, this wasn't used. And still now, we did have lots of parallel programs. Like one of the successful programs was Martyr Soleimani program for tracing. But this wasn't embedded within the PhD. That's why this program, which was lots of good intentions, didn't end into meaningful results. And at the moment, we cannot see it is established within our established primary healthcare system. I stop here.
Thank you very much. Thank you. I go to Dr. Karimi Poor. If you could also, I don't need to repeat the questions, right?
Yeah. Hello again. I understand, like the question about how trustworthy is the Iranian welfare database. I should say that it compared to the welfare database of other countries such as Turkey, Mexico, Brazil, and so on, it has some strengths and some weaknesses. So in other countries, usually how this database was shaped was through self-reports. So for example, in Turkey, people who needed social assistance, who wanted to apply for social assistance coverage would go online and file their request. And then their request was cross-checked with registration data. And in the cases of difference between their self-report and their registration data, then evaluation processes would happen. But in Iran, because we are one of the few countries with a universal basic income program or quasi-universal basic income program, we have, instead of asking people to apply for a social assistance program, because we also have different established organizations such as Imam Khomeini Relief Foundation and Welfare Organization of Iran, we just decided to use this registration data without using self-report data. So there are some issues here that we can discuss later. If you're interested, you can email me and we can talk about it. But what we have currently, the person-based data set, the Iranian welfare data set, I think is a very valuable tool. We have been able to convince almost all organizations to share their data, which in terms of implementation was a very complex task, involved many sessions and negotiations with like 50 different organizations. But in order to convince them to update their data on a regular basis, I think it's important to use this tool as a social policy tool. And
can you use it for example, during the pandemic, somebody asked to identify unemployed people? Could it do that kind of a thing?
We can use it to identify unemployed people, but if you define unemployment just in terms of formal employment. So we have the data for people who have some kind of social insurance with Tamin al-Shama'i or other, with the social security organizations or other types of organization, but we cannot trace informal employment, which is like around 25%, I guess, of our employment in the country. So, but I would like to, as Dr. Takian said, I would like to focus on the importance of civil society. And I think this bottom-up, decentralized way of creating a place-based data set and adding it to this top-down person-based data set would help us to make decentralized policy-related social policy-related decisions. And this decentralization, I think, in the long run, may be going back to Peyman Zinati's, to Mr. Zinati's question. I think will help us to gradually retain the public trust. Maybe, I don't know. This is a very complex question, but I think the decentralization helps to create, to build civil society and to maybe someday regain the public trust.
Thank you very much. Thank you very much. So we have very little time. Always when it's Dr. Mirzapour's turn, I say we are running out of time. I apologize for that. Please go ahead and respond to this.
No problem. I appreciate all those bright questions and comments, but the time is passing and the clock is ticking. First of all, let's do a wrap up about the mask experience, as there was a question on this regard. From the point of view of the app developers, especially let me name Dr. Sharif Zarchi, who is one of my friends as well, and he's a professor at Sharif University of Technology. I think from their point of view, although the mask app was not so much successful in contact tracing, but I can say a clear yes, because they saved many lives. Once they released the dashboard, the red, orange, yellow dashboard, if you remember, they were able to convince the government to put the lockdown region in each region wisely, in a manner that they can, for example, let many cities do their economic activity, but the specific zone would be in lockdown. And as I have seen the data and the result, and I can, for me, it was convincing that they saved a lot of lives once they released this dashboard as well, because they put some wise lockdowns across the country. So it was a successful experience for them. But when I scrutinized it from a national point of view, or for the whole society, I would rather it's not necessarily yes, because it's not necessarily a success story, not yet at least. Why? Because we have a lot to learn more about this application and experience, and unfortunately it's today off, and people, for any reason, people, they didn't install and use this app so much. And again, I think Sharif Zarchi is not anymore in the health ministry. They disconnected the data from the dashboard, so the dashboard is not today active. And for many other evidence and reasons, I cannot in terms of nationally, I cannot say it's not yet a success story. This is my clear and frank answer to the first question. And about the second, there was another interesting question as well about if Iran is mobile first. Yes, Iran is a mobile first country. What does it mean? It means that people, they use their cell phone more than the fixed connection to the internet. So more than I think half of the internet traffic goes through the mobile MBB, mobile broadband, rather than the fixed broadband. And these have some impact on using those kind of digital tools during pandemics. Although Iran is mobile first and it's supposed to be like more friendly, more ready to apply those digital tools during pandemics, but again, it was not successful. So we have a lot to learn from this partial failure for the future pandemics. Thank you.
Thank you very much. I think Dr. Takian raised his hand. Please go ahead, Dr. Takian.
Yes, thank you very much. There is one question by Mr. Payande, which is about miscommunication, which I would like to a little bit allude into that based on what Dr. Mirzapour said. And that's about the issue of communication. The question is whether the communication, because one of the 9 challenges I mentioned was the lack of communication or inappropriate communication from the government to the public. Of course, at the beginning, I made a very clear acknowledgement and declaration that Iran now is in a very good situation compared to a few months back. And now we have achieved lots of things and we have learned a number of things. And the reason that I wanted to somehow make a kind of political analysis was because we need to learn from this, because to have a better preparedness for the future pandemics. By communication, one of the issues, which I'll come to the mask application in a minute, is appropriate, understandable, and easy communication for health issues. In terms of health literacy, Iran is not in a very optimal situation. Our general public are not very much aware about health promotion things. Health promotion campaigns are not strong in my country. And unfortunately, health promotion has not been the cup of tea for the Ministry of Health and Medical Education. That's why one thing which I make as a good example is using mobile phones. The Ministry of Health, even the minister himself, was sending some messages in one sentence to the public. Many of us remember, but it was just "Dar khane bemanid," stay at home. That's it. In Iran, for 84 million population, I have been told there are 215 mobile subscribers. If that's true, it means that almost everyone, even in the villages, they have mobile phones. Text messages are easy. We Iranians, myself, I get at least 100 text messages every day via my mobile phone for irrelevant things, from selling homes to selling fruits to whatever. And those are mass production of text. But the Ministry of Health didn't use this massive capacity to enhance people's understanding about different aspects of COVID-19 pandemic. And they didn't start to somehow increase people's literacy about this. This is what I mean by the communication. Then there were some people, for instance, many of you remember that traditional medicine in illegal ways was somehow the prominent way of the market, and even on the media, even on the national TV, there were some people who were telling, instead of going and get the vaccine, instead of going and do something like social distancing and things, go and do this ways. I don't want to mention anything just to avoid any misunderstanding, but the infodemics, misleading information was there. And I didn't see any kind of
effective way of communication from the Ministry of Health and its agencies to bring this down. In terms of the lack of political consensus in the earliest stages, as Mr. Peyman has mentioned, that's true. It wasn't just in Iran. Unknown about pandemic, unknown about virus was huge at the beginning phases of pandemic. But one thing which I put it as another part of the communication was communication with the elite, communication with the scientists, the data, access to data, as Dr. Mirzapour mentioned, by the IT department of the Ministry of Health was very limited, even for the scientists. So the scientists couldn't have access to the COVID-19 data to do appropriate analyses and to somehow draw some lessons for the sake of other parts of the country. Iran is a massive country, and the waves and the beautiful mask application which showed some part of the country is red, some is yellow, some is blue. This means that a stepwise approach, we could learn from each other for other provinces, but we didn't have access to data, and that's still the case. That's why mask application, which was fantastic innovation by Dr. Zarchi and others, didn't make huge difference for the public. It was a good, I'm claiming this because I want Dr. Mirzapour to criticize my claim. As an academic, as a member of the community, I wanted to have an application. Wherever I go to the restaurant, I go to the supermarket, I go to the street, and this somehow traces me, and then this sends some signals to others in order to do social distancing and tracing. But because of this lack of communications, the mask application was for the elites, was for the planners, for the policymakers. It wasn't the kind of bilateral communication. Okay, fine, we failed in that, but let us learn some lessons, and you guys somehow advocate about that for in the future likely crisis, which is very likely to happen. At least we can have good understanding by the public to have a bilateral use of these apps. And I stop here. So what I want to say is, by the lack of communication was not just the government and the public and the elite and others. We need to somehow make best use of this. I'll make just one example. Everyone, even my grandmother, has a Snap. Everyone is using app to order pizza. So app is not something that we are not very familiar, but we failed to use these apps in this COVID-19 crisis because we didn't know what to do, because we didn't have good engagement with the civil society. It's not just the technology which help us to go out of this crisis. It is the way of nurturing technology and good relationship which made it happen. Thank you.
Thank you. Dr. Mirzapour, did you want to say something? If you could please keep it to about 1 minute, because we are already past 8:30.
I know the time is up, and I would just thank Dr. Takian for his conclusion, and I second his point of view on the necessity of the communication. Of course, it is a nice, interesting topic. We can discuss more in the future, and it is very, very important to communicate with the people, to convince them to use, apply, install, and use an application. It's a very important issue, and thank you for bringing up this important issue.
So I'm grateful to our three prominent speakers. These presentations were very informative to me. I would also like to thank our discussant for posing very interesting questions, and definitely thank our partner universities, University of Marburg, and other universities and institutions. With that, I give it's not a podium, but I give the podium to Dr. Farzanagan, who is here with me in the room. And I also ask that you kindly respond to the survey that is being sent out right now.
Yeah, hello, salam, all participants and the dear panelists. On behalf of NaDiMa project in University of Marburg, I just want to congratulate my colleagues in University of Tehran, Dr. Alaedini and Ms. Maryam Rahimi, who basically organized this fantastic event without any taarruf. So it was very informative for me as somebody who works on the field of in the field of economics. Sometimes I also write about COVID issues from political economy perspective. But what you presented today, it was much of information, very rich discussion from the people who are really expert in this field and know the situation of Iran from both data and policies, and those who are basically are working in this field. I guess most of our audience agree with me that it was very informative discussions and information. And so again, Tabrik, Dr. Alaedini and your team for this fantastic event. This was our 18th event under the NaDiMa project. So we are hopefully are going to organize two further online panel discussions, one in next month by our colleague in Faculty of Natural Resources in University of Tehran, and the other one by our colleagues in University of Applied Science in Cologne. That would be also great, hopefully events in the next 2 months. And so with that, we would basically finish our online panel events in this project, Natural Disaster Management project between Iran and Germany. And looking forward for future collaboration with the colleagues in Germany and Iran as well. So thank you very much also for great participants which stayed with us in this very interesting panel.
Okay, thank you very much, and have a very good evening, all of you. Hope to see you again in the near future. Thank you very much.
Khudafaz.
Bye-bye.